Welcome to CrackTalk.
Hey everybody, how you doing? Dr. J here, and welcome to CrackTalk. I got my boy Scott, and we're ready to bring you some information today and get you fired up about taking control in your life around headaches and migraines. And I'm telling you what, when I was doing the research on this, I'm about to pull it out here in a minute,
This is a
Scott.
biggie.
Dude,
This one's a biggie.
I thought we hit the biggies.
I thought like we did allergies and stuff. Actually, that one still surprises me that there's that many people that suffer with allergies. But I'm telling you, this one I had that equal. Are you kidding me? Moment when you brought out these stats.
Mind numbing how many people are walking around with these things. But first, before we get started, the best way you can pay it forward for us and yourself is make sure you like it, you subscribe, and you share it with everybody. Because, I mean, I'm telling you, when I go through these stats, you're going to realize there's probably aunts, uncles, brothers, sisters, mothers, daughters, fathers, sons that are dealing with headaches that are right in your circle of influence, right, Scott?
Yes.
That you don't even know because they're keeping it locked up because they've been on drugs, medications. Nothing's been helping.
Nope.
Okay, so I'm gonna blow your mind here real quick, okay? Because before we like to get into it, we want to educate, inspire, and then give you action steps on how to take on today's topic, headaches and migraines. So, 45 million complaints a year of headaches in the United States.
Wow.
Okay, 12% of the global population experience headaches 1 to 2 times a week.
Woo!
It's the third. Scott, this is why I didn't know.
So hold on.
It's the third.
Do that. What does that state at?
12% of the global
population
deal with headaches once to twice a week. Here it is. It is the third largest common disease worldwide.
Holy cow.
Now, I didn't know that.
Wow.
Now, I do know in the office, we see a lot of people with headaches. We see a lot of people with neck pain that contributes to headaches and migraines that are given aura and stuff like that. But I did not know, dude.
Well, you give these stats, then you think about now over-the-counter stuff, your Bayer Aspens, your Tylenol.
That's why there's a whole aisle.
I get why there's so many now allergy meds, why there's so many headache meds. Yeah, you go down, it's like headaches. It's a whole aisle full of stuff.
Oh my
Now
goodness.
I know why.
There it is. You have your allergy, you go to any pharmacy or any, like, whatever you call them, one of the big stores, the Walgreens, the Rite Aids, you're going to have a whole thing dedicated to allergies, a whole thing dedicated to digestive issues, a whole thing dialed in for headaches or just pain and discomfort, which headaches fits into that. Well, this makes sense. 1 out of 6 Americans deal with headaches once to twice a week. 1 out of 6 more prevalent in women. It is the 4th to possibly 5th most common reason for visits. This blew my mind. Not to your general practitioner, to the ER, the emergency room. So people are having headaches so bad that they can't tolerate it to a point. And you might be one of these people that are listening to this like, yes, hey, I am one of those people. I've been to the ER multiple times and they do nothing.
Yeah, and I've had a little bit of experience in my past with family members that have suffered with migraines. And it is that. I mean, it is one of those things when they hit, they're down.
They're down.
That day is done. And then the meds that they take are so potent that basically it's just,
you're laying in bed.
Yeah, it pretty much
knock you out.
It just knocks you out. Yes.
Yeah, I mean, what I found in the office is people that have specific type migraines, and we're going to go into some headaches here in a second. A migraine is a type of headache. They're debilitating. It's lights out. And the only way to kind of deal with it is, like you said, go into a coma, let your body normalize, and get through it. But yeah, so I mean, I'm just blown away that this, if you're dealing with headaches, I am so sorry. I mean, I'm sympathetic that 1 to 2 times a week to have a headache. I don't even know last time I had a headache. I've had what they call an exertion headache. You lift too heavy, you freaking strain yourself, bam.
Didn't eat enough or something like that. You get a sinus headache, weather changes or whatnot. But, and even in my thought pattern, Jay, when we were getting ready to do this podcast, I'm thinking, okay, if people suffer a couple times a month with headache, that's a lot. I'm thinking
for somebody that doesn't have headaches to have headaches,
and you're saying this is 1 to 2 times, if not more, a week.
A week.
If I had a couple headaches in a month, I'd be like, what is
Well,
going
no,
on?
they say, well, here it is. As I'm doing the recon on this, if you're having more than 2 headaches a week, they consider that a medical emergency. People that are listening to this know that if they're having we're talking a severe bout, you know, and there's different types of headaches that we're going to get in. There's tension headaches. You know, we've all had those. Stress is the #1 cause of tension headaches. You feel it. And we talk about that in the office. We got the 3 T's. We got, you know, your toxins, your traumas, and then your thoughts, which is stress. And then your shoulders go up. These muscles, he's got big ones, they get stressed out. They hook right into your neck, and they clamp down on the spine.
Yep.
Because muscles, ligaments, and tendons are all connected there. And then bam, you start getting that tension headache due to stress, all right? I got here, cervicogenic. Most common type of headache we deal with in the chiropractic office are tension headaches and cervicogenic.
Okay.
Cervicogenic means it is originating from your cervical spine, and then the muscles are affected, and it presents like a tension headache.
Wow.
So
okay.
all these muscles, they
Yeah.
start clamping down your SCMs, your trap muscles,
And
all the little muscles.
And that is originated from the cervical spine.
Cervical, that's why I call it cervicogenic, which means it comes from the cervical spine. And that all those muscles, ligaments, and tendons, or in our case, subluxation, bone moved out of place 1 to 5 millimeters, putting some type of abnormal pressure on that nerve can affect the way those muscles, ligaments, and tendons, and your entire function is going on with your neck. I mean, I'm going to do a little experiment for everybody, just so you know how vital having your neck in a healthy position is. If you're listening to this, do this. Sit up straight, and then just do it with me, Scott. Turn your chin from side to side with your head positioned directly over your shoulders, and just see how far you can go. All right? I hope everybody's doing this at home. And now, we call this anterior head carriage. This gets caused by the new term we call it. You've written forward head carriage, text neck.
Text neck.
Well, kids are down like this.
Well, I'm telling you, you were saying this just a minute ago, and
Yeah.
I wanted to launch into that, and that may be a no other podcast.
No, we're going to get into it.
Is because if you're talking about that type of headache being originated from the cervical spine, first thing that popped in my head are our younger generation, this generation now with the phones and all this stuff, getting this prominence now of forward head carriage.
We talked about it.
This.
We talked about it in the kids episode.
Yes.
Why do kids need to be adjusted? Here it is. Now I'm going to get a little bit more detailed on this one. Is because when that head starts going forward, I want everybody to imagine: is it easier to hold a bowling ball right here, centered with your body, or out here? Well, your head weighs about 6 to 8 pounds, depending on your size.
Well, what is it too? Gravity pulls. So they say for every inch your head is forward, you might as well strap a 10-pound weight.
It gets exponential. You add 2 times the weight, 3 times the weight. But I just want to finish this cycle real quick. So you did this over your shoulders. You say, okay, there's your range of motion.
Right.
And then put your head forward as far as you can. And then do that again. Look at this. No range of motion. Okay? And people wonder why is the neck so important? Well, when that starts happening right there, you are wrecking havoc on your cervical spine. Wow. The nerves, the muscles, the ligaments, and the tendons, and we've already talked about. Yeah. There's 4 million nerve roots coming out right here that are innervating your sympathetic nervous system, your parasympathetic, which means your digestion, your immune capacity, how you respond to allergies, digestive, how your heart beats, how much air does your lungs breathe, right? Your sex hormones we talked about. So it goes with everything.
Jeez. Okay.
So it's that vital. It all starts here.
Right there.
So you think about this: if the hose is kinked right at the spigot, it doesn't matter how far out you are; it's affected.
I got a 200-foot hose, whatever. Guess what?
It's kinked here. So I always like to tell people, when you start having subluxation or you start having issues here in your neck, it translates down your entire spine. Now today, specific headaches.
Right.
Think about your kids now. We're talking tension headaches, cervicogenic headaches, okay?
Okay.
You put that head forward like that, the amount of pressure or the amount of weight, your trap muscles and they're screaming in your children. These muscles and possibly in yourself. Like people that are at desk work, I mean, I do this, I have to constantly check myself.
That was the first thing that hit. I actually caught myself today, and I start to slunk down in my chair. You're typing here and you're hunkered
your
over.
head's forward.
And I'm like, man, what is happening right now? I mean, it's terrible.
And you get caught in that position because you feel like you're relaxed because you're taking some pressure off the muscles. The challenge is it starts over time creating the degenerative spinal process, which the discs start to degenerate, the bones start to deteriorate, and your muscles are in just a constant state of stress.
Yeah.
And when they're in a constant state of stress today, you get tension headaches.
Right.
You get cervicogenic headaches. So that's why we have great success rate inside the chiropractic office with those specific type of headaches.
And that's interesting. I hadn't thought about that. Is when we are in bad posture or leaning the head forward, things like that, we are forcing those muscles to stay in a state of
stretch, which it means they're holding on for dear life.
So I hadn't thought about that.
Imagine yourself hanging from a pull-up bar. It doesn't feel bad for the first, 20 seconds, maybe in my life, like 10 seconds.
10 seconds, yeah.
But then you get to 10 seconds and you're like, something's going to have to give. Well, those muscles are holding on like you hanging from that pull-up bar. And they're just waiting for that head to go from here back to here. Your spinal cord relaxes, the nerves relax, your discs start to pump and hydrate properly, those muscles come back. So a lot of times when we coach people in the office, not just adjust them, it's we do certain therapies to make sure we're getting those head muscles, ligaments, and tendons, or those neck muscles, ligaments, and tendons. We're retraining them to then hold that head back properly. And we have to train people like, look, stop looking at your phone like this, bring your phone like this. Just go with me on that. An easy little trick. Here's one of your action steps. If you're dealing with this, you hold the phone here, look at where my head's at. Or you hold the head here, or phone here, look at your head position.
Right.
And it takes some time, just like
I love that analogy.
all habits.
That is ringing in my head right now. Thinking of my poor neck, your traps, holding that head in a state of stress. If your head is forward or leaning like this or leaning down. I love that idea of them hanging.
Yeah,
the whole
hanging on for dear life.
It's like hanging on for dear life. Would you please put your head back?
Screaming.
Yeah.
They're screaming. So what happens? Soon you get to the point, your body has all these built-in mechanisms for survival. So it says, now you're tired. You're going to bed. So what are you going to do? Your body's going to force you to lay on the couch, lay in bed. Because what do? As soon as you lay in bed, you take all that pressure off those nerves, or off those nerves, muscles, ligaments, and tendons, and they now can relax. Our body is a self-regulating, self-healing system, so it's going to get you.
So this is where, so if I'm typing like this or down, look, it's funny that I will slunk to the point to where if I'll catch myself working where I'm doing this because my body is just trying to get
it's
that
trying
head
to get
straight
back,
up and get the force off. I'm like, how did I end up typing like this? And it's like my body is saying, please get that.
I'm sure there's a lot of listeners. You see this position. If you're ending up there, what do you do?
If you're hunkered down like this and you're typing whatever or on your phone or doing something like that, that is my body saying, please get that pressure or stress off my neck.
Because you're going to get in a state of pain and you continually slip into these states to reduce the pain and the discomfort. All right. So I want to get into another one, migraines, because we talked about migraines. Migraines are a neurological event. This could be a multitude of things. This is when you get sensitive to light, sensitive to sound. You get aura, you get scotomas, smells. Things trigger you. You're having a neurological. What I always like to bring people back to is like right here in the upper cervical spine, right here, you have all those nerves that are going to your face, that are going to your sinus, that are going to all these areas that get triggered with these neurological events. All right? And if that first bone, your atlas, or your second bone, your axis, are out of alignment, subluxated, you can potentially have massive migraine symptoms.
Well, what is the big nerve cluster right there? Right behind your nose.
You're hitting me, I don't know.
I remember looking at the one that comes here because you got like the TMJ.
You got trigeminal neuralgia?
Then the one that comes up in right behind your nose, the ganglia something, sphenopalatine ganglia or something like that. I just
that's where it's at, yes.
Okay. I don't know.
So you're going to be, he's getting tripped up on his allergies right now or something. Or this sphenopalatine ganglia is getting it, which is another one. This is what we get into the next type of headache. Cluster headaches come from pressure in the brain. Then there's allergy headaches. You know, how do you get rid of allergy headaches? We talked about this on our last podcast on allergies. You got to reduce the symptoms, get rid of the mucus, that kind of stuff. Get rid of the pressure. Because usually those type of allergy headaches turn into then full-blown sinus infections, which then you have bacteria build up in all these cavities, and it just creates pressure. So back to it.
Right.
Well, how does the chiropractor, well, you're probably all sitting there thinking, well, how does a chiropractor help with allergy headaches or cluster headaches or migraines? Because they seem to be these big, big, big neurological events.
Well, Yeah.
It's because if you have subluxation in your spine, especially in your upper cervical, all of those nerves are not functioning properly, which can lead to all of these things. And anybody that's listening to this, you've been diagnosed. If you have been diagnosed with migraines, you've been diagnosed with cluster, allergy, cervicogenic, tension. I mean, because usually there's no way to really get an exact diagnosis.
Right.
It's really, okay, you have these list of symptoms, then you have this. I will tell you what I have found outside of a brain cancer patient, somebody that has like literally some type of structure that starts growing in their brain. And if you are one of those people, I am sorry. I don't know how we're going to be able to help you with that. That's a whole nother medical emergency. And you start getting a different type of pain. So if you're having that, that could be a potentially medical emergency. Any of these other ones that we've talked about, 100% are possibly treatable in the chiropractic office. Specifically, I know tension and cervicogenic.
Well, then the migraine one, which is the bad one. And when you said, that is a neurological type situation that comes on, and then as soon as you said that, I thought, well, knowing now that there's that many nerve roots and things that are right there in the spine coming out, why wouldn't it cause that? Or at least have a chiropractor look at it to say, hey, there could be a great possibility of at least getting relief.
Well, Scott, what are the medications they put you? Imitrex, Topamax, Neuron. You know what they do? You know what those do? They numb your nerves.
Numb your nerves.
They numb your nerves. Yeah. So that means you have some type of hyper irritation of some nerve root in your body. All I'm saying is, listen, we get a lot of success with this.
Yeah.
Auras that disappear. Scotomas, which are like lights flashing, they disappear. Right. People start getting adjusted. Not 100% of the time, because people do have underlying issues. But if we start making sure that people's necks are aligned, you listeners, if you're making sure you're going to the doctor, you're getting your spine checked, the chiropractor, you're getting x-rays, you identify subluxation, you're getting those subluxations treated, and you're not seeing some type of relief, it could be you should be escalating.
We need to go to the next level, or whatever that is.
Because there could be something, and I have had patients where we got results on the first part of their care, and then the headaches were coming back, brain cancer.
Wow.
And nothing we can see inside the office. They do a full-out brain scan, but you better believe we've referred them out. It's like, this should be helping, not escalating. So you just know that the body at that point is going through something that is different. And that's when I say something like a medical emergency. It's something outside of the control that we have in this office.
Right. Well, think about what you said. If going to the chiropractor, and then like in our offices, we do offer the active therapies and things to work on that posture.
Constantly, yes.
So you think how important posture is with headaches, with the correction and the keeping the spine aligned. Let's say
100%
in that neck. So not only adjusting, looking at that neck, making sure it's structurally sound, doing any adjustments to get rid of that subluxation or any kind of pressure on that nerve, and then working with that posture to keep it back.
Dude, posture is a window of the spine. We say this at the chiropractic office. Posture is a window of your spine. If you have a high shoulder like this, if your head's like this, I mean, I can look at you. I almost know what your x-rays look like. And often they look worse than what I imagine they work with. So posture is the window of the spine. The other thing that we in the office, it isn't just fixed inside the office. We constantly coach, and I'm coaching, and this is going to be one of my action steps here, is watching your daily habits. If you're ending up in the posture you just positioned, if you're looking down at your phone, and you're not doing things to reverse that.
Yes. If you see, suffering headaches maybe have gotten worse, they're coming on more and more prevalent, take a minute today when you're on your phone, or I'm always a big proponent of logging things. So sit down and say, how many times did I get on my phone today, and how many times was I like this?
The good thing is, if you have an iPhone, I don't know about the Android, it tracks your screen time.
Oh, yeah.
So if your screen time is increasing, it's a high probability, if you're not in an ergonomic position, you are wearing out the muscles going to tendons.
Think about that poor neck all day. You're sitting there looking at your phone. Think of yourself. I want everybody to think of that. Next time you're looking at your phone like that, think about your poor neck up there hanging on for dear life on that bar.
Yeah. Or your children's neck. I'll tell you what, even more prevalent.
Yeah.
So I talked about this with kids. We're dealing with kids 5 years old, 6 years old, 10 years old, chronic migraines, chronic cervical genic headaches, dealing with stuff. This was not even a thing 20, 30 years ago.
No.
I mean, you had a kid get a concussion, he got his lights knocked out off the monkey bars, or because he got knocked off a King of the Mountain. You remember that kid?
Oh, yeah.
Or he's on the football field. Now you're having kids that are presenting whiplash, or a car accident, whiplash-esque.
Yes.
Neck problems,
yes,
and associated headaches because of lifestyle habits that have become normal.
It's not because of a trauma. It is actually kind of a, like I said, it's a lifestyle thing.
Well, it's not a major trauma.
Right.
It's a micro trauma, and I want everybody to be clear on it. A micro trauma is a repeated event that destroys your body over time. So it's like, yeah, we get the macro. Hit with the Mack truck, right. You got hit by the linebacker, you got thrown off the monkey bars like I did one time when I was a kid.
Right, every one of us has broken an arm.
I think that's why they got rid of those monkey bars, or they got rid of the what do they call those little tripod gymnasts? Oh man,
which
King of the Mountain.
Every now and then you'll go see the old school playground on the old school elementaries. Like they still got one.
You get a little gut, you get a little gut, like you get a little tingly.
King of the Mountain.
Yeah, at our age we wouldn't even get to the top, and if we fell, you better call the ambulance. That's what I know. But I want to give, so here's the deal. What do? If you're experiencing these type of headaches, if you're taking Imitrex, Neurontin, Topamax, or any of these, I mean, I'm sure there's newer ones now. If you're taking Bayer, if you're taking muscle relaxers.
We talk about those bad ones, but here's the other thing, Jay, the over-the-counter stuff, the NSAIDs.
It's just as bad.
I mean,
stuff
I know
rips your body to
people
pieces.
that take these things like Tic Tacs.
Yeah.
And have no clue that it is just, those things are so detrimental to your health.
I will tell you, there's a reason why a lot of countries don't even sell Tylenol.
Yeah.
I was just in Dubai, no Tylenol. Why? Tylenol, there are more overdoses on Tylenol than almost any other drug. People don't understand that because it's an OTC med, over the counter. You can get it at any of the box stores, the Walmart, the Walgreens, right? It's right there. So that's one of the reasons it's overused is it's readily accessible. It's fairly cheap, right?
Yeah.
And people know if I'm in pain or if I have fever, bam, grab the Tylenol, put it in my body, and it does work.
Well, and then as humans, what do we always think? More is better.
Well, what happens is, just like everybody's heard of alcohol tolerance, right? We also build medication tolerance. So your body uses it first. Maybe the Tylenol hit you right the first time.
That's great.
You took 200 milligrams. Okay, now a couple weeks later, you're taking 400. Now you're taking 800. Now you're taking 1600. Now you're taking 2400. You are wrecking your liver, your digestive tract, and this is where people get, it's not that they're an addict.
No.
They just are dealing, they're 1 out of the 6, possibly you are. They're 12% of the population that are dealing with something that is untreatable.
Right.
Or has not been shown to be treated well by current medicine.
I haven't got to the root cause of what could be doing that.
Which, bam, brings me always to the point, chiropractors have always been coined headaches, neck pain, back pain. There's a reason for that. The public has kind of made that generalization, not the chiro, not the medical profession. The general population said chiropractors are great at treating headaches, neck pain, and back pain. And we are. And a lot more. But I will tell you, talking today about headaches and migraines, I'm passionate about it, especially with children right now, because children, just had my grandbaby. All right, and this is for everybody. Just had my grandbaby 2 days ago, so hopefully this will be time stamped. But here we go. The doctor told her something that I thought was so cool, because she fought to have the baby and natural, and then whatever happened. And he said, "Don't worry about the baby and any issues the baby may have." They said, "We see babies in here that get broken through the birth process, dislocations." They get bruised up, beat up, banged up. I don't know if anybody's really seen the birthing process or been through it. We all did. There's a reason we don't remember it. Okay? It was brutal. So all right? It's like you talk about a macro trauma, Mack truck. They said, but here's what's amazing about the human body and babies especially. And that's what I love talking about in this kind of setting is, in 3 months, you'd never known that child had a broken leg, dislocated hip, stretched cervical spine, bruised head, bruised back. That's how fast the body gets in there. The power that made the body heals the body. That's how fast rest, when that baby starts breathing and eating on its own, it goes into that self-healing, self-regulating. There's power in that. Back to we educate, we inspire, and we give you action steps. That if a baby can do it, a young child can do it. So if a child is dealing with headaches, a lot easier to get them manipulated and get their spine straight. Gets a little bit more difficult, our age group, a little older than us. You got some degeneration and things. Not that it's impossible, but I will tell you, Scott, there's nothing out there that I have seen that can deal with any of the types of headaches that we've talked about that are treatable by chiropractors that have a higher success rate outside the chiropractic office. Absolutely not. So let's talk about what are some action steps. Right now, you got educated that headaches are a problem. And if you're dealing with, I'm sympathetic to it. I know you said it hit you. I hope you get inspired that you do not have to live this way. That 1 to 2 headaches a week may be common in your life, in the people you know life. I know people in my life. It is not normal. Your body is not made to have headaches. You should not be in that type of physical pain. So first thing I would say, when patients would come in, I said, first of all, make sure you're hydrating.
Yes.
You got to hydrate because you're working in muscles overtime. You got to get that lactic acid out. And you got to watch your nutrition. Are you taking the things and stuff? Are you eating a good diet? So on and so forth. Next one, kind of like, are you drinking too much caffeine? If you drink 55 Mountain Dews, you're probably going to have a caffeine-induced headache. Which is, by the way, people go to the ER with caffeine-induced headaches and think they're about to die because their heart's palpitating out of their chest. They're having an anxiety attack and their head feels like it's going to blow off their shoulders. Caffeine-induced headache. Very similar to an exertion headache. If you go to the gym and you try to lift too much, or you try to pick up something, or you just
strain a little too hard. Yeah.
And I'll tell you, I have a story about that, man. I was in Turks and Caicos once, and I experienced headaches for the first time, and I got fully dehydrated. And it's hot. You're on the beach. You're not drinking as much as you're supposed to be drinking. And I went and we did some physical activity, so I was completely dehydrated. And I woke up the next morning, 3 months, that headache stuck right there. I was getting adjusted. I was hydrated. So that's the other part of it is I found once your body gets into that state, it takes a lot for it to heal back from it. And I did damage. I was scared. I thought I was having a stroke. I thought I was having all the fun, the TIA and all this. And it was just a throbbing cervical. It felt like it was coming from my neck, but it really wasn't. I did something. And I did something. And my wife and I still talk about it. I will never have that vent. So when you see me, I'll make sure I'm hydrating with some water and whatever I need to do. So rest is the next most important step. And this is when you're going to give your body, and I know anybody that's listening to this, you know rest is best. This is when you're giving your body the opportunity to reboot, reset, re-engage, and kind of get your body normalized, allowing those muscles, ligaments, and tendons. You got to make sure, get in a quiet room, get in a dark space, remove all outside stuff. Stimulus, great word. And then just, boom, give your body 15, 20 minutes.
I love that. I've said that a lot. It's like sometimes you go to sleep, it's like, all right, I just need to go to bed. Yes. I mean, and we all get there. Sometimes you lay down, it's like, I got to reset. So there is actually something to that.
Your body will reset. It has the ability to reset. But a lot of people meditate. So it's just a different type of what I quote unquote called rest or rebooting. The next one is stretching. And I know, man, everybody's like, oh my God, here he goes with the stretching. I know you're already in pain. It hurts. It hurts. Your muscles are screaming, but I will tell you, you've got to stretch them. Going from side to side like this, making sure you're getting all these muscles. Maybe you can get somebody to help you. Massage is another good one. You got to get that lactic acid out of those muscles that are hanging on for dear life.
So when you do that, so that's actually great. I'd say a couple of steps here. So stretch to the side.
You want to just make sure you're feeling it in here. Stretch. Hold it for 10 seconds. Let it relax. Go to the other side. Hold it for 10 seconds. You want to make sure you're feeling it. If you're getting in too much pain, just stop. Okay?
Oh, that feels good.
Yes.
Should you go forward?
Forward and backward, yes.
Okay.
Rolling a towel up under your neck is one of the most fantastic things that I used to tell people to do.
The back?
Right here. Right here. You roll a towel, get it tight like this. You lay down on the floor, let that push your spine into that nice, proper
you're
position.
Actually putting the curve back into your
changes people's life. I mean, when they get back up, their spine goes back into where it was. But for that moment, getting your body the ability to stretch those ligaments and tendons.
Now, if you do that over time,
100%.
Okay.
That's actually what in our office. Not only do we want to adjust and get your rehab started here, and we mentioned this before, you have got to be actively participating in your life.
Right. Well, and I guess
At home to move yourself out of non-ergonomic positions, to get into ergonomic positions, and you also got to retrain your muscles, ligaments, and tendons while at home. We can't just do it here. You can't just get adjusted, hallelujah, you're healed, and then do some rehab. I wish it worked that way.
We all do.
Okay, look, if I had the magic wand, I would have already delivered. I have a line out the door.
I keep waiting to be able to do that with diet and exercise, but
Yes, I'm doing it right now with my lipo wand, fake lipo wand.
So towel, rolling a towel up.
Yeah, tight. Get it tight, right under the neck. Depending on your size, you might have to get a dish towel, stretch. What you're doing is you're just stimulating, Scott, all the muscles, ligaments, and tendons that could be contributing to these headaches and making them worse.
Yes.
So even if you're dealing with a migraine that's not coming from your cervical spine, you want to still take this out of the equation.
Right.
And it could bring you from a 9-10 down to a 5-6, which is tolerable in your life. So I hope everybody's listening. The next one is what we're here for. Get your spine checked. Listen, subluxation bones out of place, put abnormal pressure on the nerves. They make sure your muscles and tendons are working overtime. It causes a lack of structure, which leads to a lack of function in your body, and it can just trip into many, many more challenging and difficult things. So get a recommendation. Reach out to your friend group, your Facebook group, your InstaPals, your Snapchat. Look online, find somebody with good reviews. Reach out to that chiropractic office. Get in their office, get your spine checked, get x-rayed. Any recommendation you're going to get, I'm telling you, they're going to take you through the whole process. History, consultation, a full orthopedic neurological exam, take x-rays of your spine to see what's going on. Unless you're pregnant, then, we kind of take that one out. We don't want to radiate pregnant women unless it's absolutely necessary. And then let that chiropractor do their work. Because if you could take a natural rehab, which is what we do, an all natural come from, no drugs, no surgery, you start getting your spine aligned, you get all of these nerves flowing, you get these muscles and start getting them trained to hold your body properly, I'm telling you, Scott, miracles.
Changing lives. Well, and
miracles.
And that's something, if you suffer with headaches, migraines, any of that pain, if you have not ever considered seeing a chiropractor or having a chiropractor check out your spine, I mean, that's one thing I always urge people to say, go give it a shot. What is the worst thing that can happen is you get relief.
And I'm gonna tell you, Scott, I'm gonna add a caveat to this. Don't think it's going to be one and done.
No.
That's the new culture we have is one pill fixes the problem, one adjustment, one this, one stretch, one workout. You get an 8-pack. I eat one salad, my abs just come popping out. Wish it was true.
Well, here's the thing.
You got to give chiropractic time because it's physical medicine. I think people miss that sometimes. It's just like going to the gym.
Well, I had a thought earlier when we were talking, Jay, is the body has the innate ability to heal itself.
Yes.
And one of the things that kind of popped in my mind, and it just connected the dots again, is you think about we were talking about the monkey bars, the cage, falling in when we broke our arm. Yeah. It takes how long for a bone to heal?
A while.
Okay.
And then really the bone heals pretty quick. You know what doesn't heal quick? The ligaments, tendons, and the muscles around it.
You think how that does? The body is healing itself. A cut takes weeks to heal. So imagine that's what's going on inside your body when you take those subluxations out.
But yet everybody wants that one and done.
So if I broke my arm, I wish. Think about that. You break your arm, it's like, it'll be better tomorrow.
It'll be better tomorrow.
So you want it to be done quick, but it can't. The body has to take time to heal itself.
It's taking time to get into this condition, and it's going to take time, hopefully much less time, to get out of it. But you've got the one thing I see with people with migraine headaches or real type of cervical headache, they drop out of care too soon. And they're not going to a chiropractor that's doing spinal rehab. Make sure, I'm not going to try to do air quotes again, but make sure you're asking, are you doing rehab? Where you're retraining my muscles, ligaments, and tendons. A lot of people are going to chiropractors where they're just rocking the spine, they're adjusting it, and then letting them out the door. I'm going to tell you, if you're dealing with specifically headaches and neck pain and migraines and any type of these, you want to make sure you are doing full out rehab, which takes me to, you need to have x-rays, and then you want to get re-x-rayed
Right.
to confirm that you're having spinal changes. So there we go. You guys got it. We understand headaches. I hope you got inspired about what the heck you could do about it, and that you don't have to live like that. And then bam, bam, hydrate, nutrition, watch caffeine intake, rest, stretch, and get your spine checked is the best thing you could do for you and your family. All right? So Scott, take us home.
All right. So as always, we finished up. Appreciate everybody sticking around, watching. Please share. So we got to go through our list. Please like it, follow us. Share this with everybody you know, especially if you know somebody, a friend, family member, loved one that is dealing with any kind of migraines, headaches, anything like that. Please share this with them. Like I said, like us, follow us, and stay.
Hey, here it is. Welcome to Crack Talk. I hope we impressed you guys today, and you gleaned some information to take into your life. And know your friends and your family members that are dealing with headaches and migraines may not have to live like that.
Right.
See you guys.
One more thing.
Oh, go ahead.
If you guys have a suggestion of a topic that you guys would like us to cover. We were talking about this last week. If anybody watching this has a question about something, wanting to know if chiropractic can help out, please leave us a message.
We love it. We love the challenge. What the premise of this was is taking unrelated conditions and relating them back to chiropractic, and just really with the inherent wisdom that the body, a power that made the body can heal the body, and how these things are connected, but not necessarily like they're just not directly connected. So send us some suggestions. We'll take it on.
We'll do it. Guys, thank you all. See you soon.
Bye.